Hello, friends. Myself, Dr. Neeraj Bansali. Welcome to this exclusive program. We have designed this program that is based on Vasa concept. Friends, today and tomorrow, there will be a case presentation by individual cases who recovered from the Vasa concept treatment. This is a phenomenal concept. That's why I am insisting every physio to learn this concept and to adopt this, to understand this, and to implement this concept. Not taking your much time now, I would like to start the presentation. Let us see. We will start with the patients.
Yeah, so we have Mrs. Padmashali who is going to start right now.
Thank you, sir. Good evening, all. This is Sheetal Padmashali, the mother of Shreyas Padmashali. I'm here to share my experiences after accident we had in 2011 and how Vasa concept has proven a blessings to us. Shreyas was a normal child, enjoying his life, school life, and his daily routines. Like a 6-year-old child, all his activities were on. Like every day, we have gone for a vacation, summer vacation, and while on our journey back, we had an accident in the city of Mangalore, where this 6-year-old child, we three of us were there, myself, Shreyas, and Shreyas' father. All three of us got injured, but Shreyas was injured the most with the severe head injury, right side portion of skull into pieces, then brain protruding out. His spinal cord had a major injury. His lower jaw dislocated. With such conditions, Shreyas was admitted to the hospital immediately after accident. He was in a very critical condition. Even doctor was not having any hope for his survival. He was on an incubator for 8 days, and then 15 days he was in ICU. Soon, gradually, he started responding, and like when his condition was stable, like we had shifted from Mangalore to our hometown. Actually, when I saw first time Shreyas after the accident, it was like shattering for me to see only son, 6-year-old, surrounded with all PCs and computer machines with all wires and all needles pricking in his body. He was just lying idle on bed, motionless. In this, as soon as his condition got stable, like we shifted from Mangalore to Mumbai, our hometown, where he got hospitalized, admitted to very well-known hospital in Mumbai. In that time also, he was having the IV pad. He was on RT feeding. He was not able to speak. In fact, he was not even able to recognize any of us. He was, because of trauma, he was in temporary memory loss. And plus IV pad was there because he was in continuous urine infection. IV pad was there. He was on water bed. He was hospitalized there in Mumbai for 2 months. The routine was going on, like as soon as we enter the hospital, all the procedures were done. Again, the CT scan, MRI, all the things to just see whether his condition is changed during the traveling. And he got admitted, and he was there for 2 months. Like for after admission, like we had this accident in 23rd March 2011. We got admitted here in Mumbai in month of April. Like first few weeks, like the routine was on. The doctors and nurses used to come. They used to check Shreyas and give the time. RT feeding used to given on fixed timings, this that. Nothing much was happening at that stage itself. Exercises were going on. That means like just hands and legs were moved by the physiotherapist who used to come in the hospital in the sleeping position only. Shreyas was, though he was conscious, but he was speechless. He was neither recognizing any of us, just like it is just a moving body lying on a bed. He was on water bed that time. After a few days, like the days were going on like that, and with no improvement from Shreyas side in terms of the memory recovery. Like when we got discharged from the first hospital after 23 days, I still remember the words that doctor told me there. accident was very severe. So whatever the thing is happened to him, we had tried our level best, but how much Shreyas will remember, when he will remember, it's in God's hand. We tried our level best to do best possible treatment to him. So keep trying, pray to God, never lose hopes, but don't over expect, because his injuries were so severe, he could not predict that time the recovery of patient. The in this condition, like we were in the Mumbai hospital, these thoughts were in mind. I kept trying, though Shreyas was not recognizing me, any of us in the family. The whole day I used to sit with him, showing him his favorite toys, telling him stories. Somewhere he will recognize us, so that he can also identify us and start responding. So one fine day, after having so much of struggle, like after 1.5 months, finally I could hear the word from him, Mama. Finally, he identified me. We were so happy that day, after the struggle of 1.5 months, that at least his identity is back. Then our real struggle battle started now for his improvement. We thought we have to take his improvement now more aggressively. So we were in continuous touch with doctors, asking them how we can remove his RT and how he can be able to, take food intake normally. First, doctors were very reluctant to do so, because yes, of course, the condition, he has come from such a critical condition. They were got afraid of, they might, the if we try to feed him from the mouth, like the food or the liquid might go to lungs, then he will have a breathing problem or choke up problem. So, like, first of all, we were in traumatic condition, and instead of support, like, we got such kind of replies from the doctor. But still we had a firm decision. We convinced them, at least we will try, you are there with us in the hospital, so if anything goes wrong, we can tackle it out together. So because of our insist, they very reluctantly, but they started the allowed us to feed Shreyas with the spoon. We literally started with 2 spoons of water to feed Shreyas. He responded well. Slowly, we gradually increased the liquid intake, then moved to the semi-solid and then solid. And luckily, the RT got removed. He could eat his food orally. Same thing we insisted for the urine tube also, because all the time he had a urine infection, urine bag was there. So on our this thing insistence, again doctor tried twice, to remove the urine bag, and unfortunately Shreyas could not pass the urine out even after waiting for 8 hours. We were a bit disappointed, but it's okay, some improvement was going on, so we were satisfied. But one fine day, with God's grace, the urine tube came out of its own only, and it was Sunday night, no doctor was available. So like sister on the duty told to keep him on diaper, and we were so lucky that next day morning we opened the diaper, it was wet. So at least he had started passing the urine as a part of improvement. So we decided now it's a time to get him discharged. During the discharge also, we had been given the list of medicines, and we were told how to give the medicines. Along with that, the physiotherapy also has been advised to us, what kind of exercises in sleeping condition we have to follow. Plus we were continuously advised he is having a major critical injury, so he has to lie down, he has to sleep most of the time, he has to take rest and things like that. So with that all mental stress and the lot of responsibility to how we'll manage at home and this and that, like we took a discharge from hospital, we got him home. So as they suggested, like we started the physiotherapy. Like, see, first of all, for us it was so new, brain injury, spinal cord injury, we never heard of. Basic treatments like heart attack, diabetes, at least we are aware of few things. But this was like completely new thing for us, but still we are trying from our reliable sources, internet, through information, through friends, families, how better ways we can improve, get the improvements in Shreyas. So in that confused state, like we followed whatever the doctor has said. Again, here while the discharge, during the first time of discharge from the Mangalore, we got a very supportive attitude from the doctor. From here, from getting discharged, like whenever we used to insist them, like regarding the removal of RT and this that, they always used to tell us, you have, your son has improved so much, so you thank God for that. Such patients remain on the RT feeding. You have to learn yourself for the RT feeding. Urine bag, so it is mandatory for such patients. And we were like, got so negative replies for them. Somewhere we also started thinking, my God, my son is not going to stand and sit up and walk again. So that this completely two contrast experiences from the medical field, like we got him discharged and we were following the whatever doctor is saying, we were following the same thing in terms of exercises. One belt was given to him, he was not allowed to sit for many hours or together. Few minutes also he used to sit. He used to complain, neck is paining, back is paining. Most of the time he used to lie down. Then whatever the medicines they told, we used to give him. Most of the time he used to feel drowsiness, where more than 18 hours he used to sleep. And physiotherapists used to come on sleeping position only, the exercises used to happen. And that's it. But after continuing this process for a couple of months, like his body was getting more stiffer and stiffer. Constipation started. In this condition, so we don't even expect that sensation getting, because below waist he is paralyzed because of the right side brain injury. His entire left side was paralyzed. He's motionless from left side, from top to bottom. Even his left hand was completely paralyzed. After doing these exercises also, after 3 months, like he could not even get up from bed on his own. A couple of people from the family to make him sit on bed. He was on, so he was completely 100% dependent on his on others. So we were in continuous inquiries, how he can be improved further physically, cognitively he was so bad. We do understand the brain injury is there. He could not even remember what he had in the breakfast. If I ask in the lunchtime, what you had in the breakfast, he could not remember. So we were a bit worried about his future, his further improvements, like how we should go about it. So during these 3 months we were not sitting idle as such. Through net, everything we were going on for inquiring. In one day we could find a stem cell therapy in the net information. So we thought might as well to go to the concerned authority doctor who knows, who's expert in that, and take the advice from him. So we have taken a very good stem cell therapist appointment. And like when we went there, like we could see that he showed us many interviews and everything of his old patient, how the stem cell has improved the patient from dependent patient, how he has gone to dependency, their eyesight improved, physical improvement was there. We got so carried away because we were so keen to have Shreyas, to get into the normal as soon as possible. So we just decided we'll go for this stem cell. Like, though the cost told by a doctor, stem cell is like beyond our capacity, because past 6 months we have spent huge money like anything on Shreyas treatment. But it's okay. Any parent would have thought, forget the money, we'll just get it done to have the Shreyas independent on his feet again. So after quite consideration, we went for the first stem cell therapy on November 2011. We got that painful surgery done on Shreyas. He had suffered a lot, severe headache, backache. He cried a lot after the surgery, after effects of surgery. Then he cooled down after a couple of days, and like again the physiotherapy has started, where we had been advised to use calipers, and the suggested exercise were making him stand with the support on board, with the calipers to be used, and move the legs, everything in sleeping position, like passive movements kind of. So whatever the exercise were told, we were doing. You can see in the slide, we were doing all these exercises where we were doing continuously 2 to 3 hours. A physiotherapist used to come and they used to take these exercises. But still, after doing these exercises for a couple of months, 3 months, like you can see, three people were needed to make the Shreyas stand on his knee. He could not do anything on his own. His left hand was like that only, with no sensation at all. His fists were getting tight, leg spasticity was there. So we were worried, like after doing stem cell also no improvement at all. Forget about the cognitive improvement, no physical improvement at all we could see. So we again reconsulted the same doctor. Again, he told us the same dialogue that we used to hear 6 months back. He has such a traumatic accident and so severe injuries. How you can expect to him to become so normal? So much he has done, this, that. But still, our insistence. Then he told us to do n number of tests like SSCP test, urodynamic test, and couple of more tests, which was so expensive and time consuming to show us the result, how internally he is getting developed. So he showed us the report and told if he has started improving, but his injury is major. So like you have to go for the another stem cell one more time to get the better result. We were like shocked and shattered at that time. Again, such a huge expense, like how to go about it. But after giving second thought, like we thought so much we had done it, so why to lose this last hope also? You never know if he is recovered and he can stand on his feet again. So again we have gone for one more loan, and we have done the second stem cell therapy also on Shreyas. That we have done in after 6 months of first therapy. Again, the series of physiotherapy, putting calipers, this, that, everything happened. Like 3 months have passed, 4 months have passed. We were in June 2012. Like nothing, no improvement was there. His leg spasticity was as is. Urine infection was continuously going on. He was continuously on antibiotics every day. Every month I have to give the urine for testing. Then this infection is detected. Then again the antibiotics to change. That vicious circle was going on. His hand getting tighter and tighter, body getting stiff. He is getting overweight. He was getting obese. So we were not knowing now what to do. You know, whenever you used to go to ask doctor, they used to say that he has improved so much. No, you thank God for that. So, you know, suddenly because of this continuous replies from doctors so negative, you know, somewhere we started feeling it might be like, you know, the injury was so severe, so might be Shreyas might not improve. That's it, what he could. He has to live with it. Unless and until we got to, in this confusion only, we one day we find one article in Marathi newspaper saying that Midas touch, Parisparsha. Like I've gone to the article, and it is for the brain stroke patients and the patients who are having such kind of problems, or brain injury or spinal cord damage and things like that. Again, I thought we were so fed up of 1 year we have done trial and error on Shreyas, all experiments under the name of treatment and rehabilitation with no use at all. He was as is bedridden. So after reading the article also, we give a thought and again one more treatment. But when I read the article very in detail, like 2 catchy points I found the most. That is, it is free of cost, and first of all, no medicines, no treatment, no therapy or as such operation is involved in that. So that could not sit me quiet, you know, what is in such a thing. I have done so much of advanced technology, we have gone through so much medicines he has taken, so much physio he has done, not a single person improvement in him we got it. So how come whatever this therapist Vasa concept is there, how can it be without any medicines a person can improve? So with that keen curiosity, like we decided to meet doctor once. So after completing the procedure told by the concerned person, we finally got the appointment of Dr. Vasa.